People often ask about the different components of a breast and what we're trying to achieve with a breast augmentation. So I'm going to go through that with you now. On the left of the screen, you can see the pre-op photo. There's not much of a lower pole curve. Her upper pole is very flat and there's virtually no projection of the breast. And then we can see after she's had an anatomic implant, we can see a much nicer lower pole curve, which is the arc that goes from the inframammary fold up to the nipple. You can also see we've got a nice upper pole, but because it's an anatomic implant, we don't have that overly rounded upper pole scenario. And the other area where you can see some improvement is in this projection. Because we've got an anatomic implant, the maximum amount of projection is here in that lower pole. This is the frontal view. And you can see in the pre-op view, the breast ends here. There's not much in the way of cleavage and there's a big gap between the breasts. And then this is the lateral curve of the breast. You can see some of the chest wall beyond the breast. And this is what women don't really like commonly and what they're trying to cover up in a breast augmentation. Now you can see on the right, the after photo, we've been able to bring that medial curve or cleavage lines much closer together. There's also now a bit of lateral or side boob. So we're covering up that part of the chest, which I think overall gives improved proportions. So there you have it. They're the different anatomical features of a breast and what we're trying to achieve in a breast augmentation.